Do you find it difficult to have an erection, or does the erection last for very less time, leaving you sexually unsatisfied? You may suffer from erectile dysfunction. Don't panic, you can get it cured. Erectile dysfunction is defined as a sexual dysfunction which is characterized by the inability to develop or maintain an erection of the penis for satisfactory sexual intercourse regardless of the capability of ejaculation. It is also known as impotency. It is found that 1 in 10 people suffer from erectile dysfunction. So don't worry if you are one of them. There are many underlying physical and psychological causes of erectile dysfunction. Reduced blood flows to the penis and nerve damage are 2 of the most common physical causes. Underlying conditions associated with erectile dysfunction include vascular disease, diabetes, drugs, hormone disorders, neurological disorders, pelvic trauma, surgery, radiation therapy, a venous leak, or psychological conditions. A lack of zinc can interfere with the maturation of the reproductive organs, as well as interfere with reproductive functions and processes. It can contribute to impotence, chronic diarrhea, poor appetite, and thus significant weight loss of the unhealthy and undesirable sort. Hair loss, and the slow healing of wounds are all associated with zinc deficiencies. So too are open sores on the skin and in the mouth, strange tastes in the mouth, and inefficient or reduced mental functioning, especially cognitive processes. So be sure to include lots of zinc-rich foods in your diet, including red meat, fortified cereals, oysters, almonds, peanuts, chickpeas, soy foods, and dairy products. Zinc is vital to many internal processes and supports immune function, reproduction, and the nervous system. It's also imperative to include other vitamins and minerals in your diet, as they may also help improve erectile dysfunction. Be sure to eat whole, fresh, unrefined, and unprocessed foods. Include fruits, lots of richly pigmented berries to support vascular integrity, vegetables, whole grains, soy, beans, seeds, nuts, olive oil, and cold water fish, salmon, tuna, sardines, halibut, and mackerel. Avoid sugar, dairy products, refined foods, fried foods, junk foods, and caffeine. If you've found in the past that you're sensitive to certain kinds of foods, eliminate them from your diet, as it could be a contributing factor to erectile dysfunction. Also be sure to drink plenty of water. A good rule of thumb is to drink 50% of your body weight in ounces of water daily. Try to avoid alcohol and smoking, as they can have a negative impact on erectile function. Erectile dysfunction may be chronic or recurring, or it may occur as a single isolated incident. In the past, it was assumed that impotence was primarily a psychological problem, but many therapists and physicians today believe the majority of all cases of impotence have some physical basis.